Hello, my name is Ravi Vij. I'm from My Cancer Haven. And today in the Conversation with Cancer Expert series, I have Dr. Ariel Grajales, a rising star in multiple myeloma at one of the leading cancer centers, Moffitt Cancer Center. And we're going to talk about a new class of drugs, which is getting a lot of press these days, Celmods, moving beyond the image. So welcome, Ariel.
Thank you. Thank you so much for having me.
So, Ariel, can you just lay the ground by telling us what are cell mods?
Well, I always like to start by saying that Celmods, it's although it's a new story, it's not that new altogether because everything started with the Imids back in the day, right? That we started with thalidomide, kind of a serendipitous kind of finding, which we ended up bringing into the myeloma space and finding good activity from it, right? Without truly understanding why. Then lenalidomide and pomalidomide came into the market, still with not a clear understanding of what the pathway, the mechanism of action was. And then it was around 2010 when this finding of the Cereblon pathway and the protein degradation was started to be understood. And Celmods, and nowadays we have three currently under investigation, iberdomide, mezigdomide, and cemsidomide, are basically novel protein degraders that bring these ligase and target proteins into proximity, right? To begin this protein degradation through the UPS, the ubiquitin proteasome system. And that leads to this increase in apoptosis and decrease in cell proliferation altogether and the death of myeloma cells altogether.
So you mentioned there are three in development. Let's start with the first one, iberdomide. So what have we learned? What are the trials to date that we are aware of?
So iberdomide it was essentially was the first CELMA to be studied altogether, right? And it was at the beginning used as a single agent or just in combination with dexamethasone. And this is essentially what this pivotal trial essentially looked at, right? Population with relapsed refractory myeloma, patients that had essentially received therapies with proteasome inhibitors with such as like I mentioned earlier, lenalidomide and pomalidomide. They were essentially all of them were IMiD refractory, but also they were exposed and refractory in the vast majority of the patients to bortezomib and carfilzomib. These patients also they were refractory to daratumumab as well.